The pathology of intracranial aneurysms is quite complicated. So unlike a brain tumor surgery where I do the tumor and completely excise the tumor, and patient comes out and the post-op day patient 1 is patient fine. So he is going to be good even in the post-op day 7, post-op day 10 and the again discharge at the early stage. But no, that's not the scenario with intracranial aneurysms. What are the best care I give? Either I do a best clipping of the aneurysm or endovascular coiling of the aneurysm. Still, there is something called as vasospasm does set in because of the already existing bleed in and around the blood vessels. So, this vasospasm usually sets in after third day of the bleed, the extent up to 21 days. The maximum is up to 7 to 8 days. So, irrespective of how good the clipping or how good the endovascular coiling has been done, the spasm exists in 15% of patients depending upon the amount of already existing bleed around the brain. So, the outcome in aneurysm surgery depend upon multiple factors. One, what is the status of the patient prior to the intervention? How good the GCS is. Second thing, how early the patient has landed up in the hospital and how early the intervention has been done, either clipping or coiling. Last one, the most important part is the good ICU care. So for example, patient has bled yesterday and I operated the patient overnight, clipped the aneurysm and patient has been shifted to ICU. So probably patient is good for next 2 to 3 days and suddenly while I am in the rounds, suddenly patient started talking but suddenly started having some weakness in the hand over a period of next 5 to 10 minutes. So this is where you need to understand that patient is having a spasm, there is a thinning of the blood vessels within the brain. To prevent further complications, we need to address the spasm as early as possible. Either we take him for the cath lab to look for the spastic vessels and we do give some chemicals endovascularly and relieve the spasm. And we also give medications to relieve the spasm both intra-op and post-op period. Aneurysm patients, even a good surgery or good endovascular intervention needs a good follow-up in the ICU for next 5 to 7 days to prevent the further complication, that is a spasm. Apart from this spasm, aneurysm surgeries or intracranial aneurysms has fewer set of complications like they can develop seizure, lateral disturbances, hyponatremia, hypokalemia and all these things. Or patients can also land up with something called hydrocephalus where because of bleed, what are the fluid in the brain may not be draining out properly. These are the complications. The outcome of aneurysm surgery or intracranial aneurysms depend upon like the early arrival to the hospital, early intervention, good intervention for the either endovascular coiling or the open clipping of the aneurysm, and the good ICU care, good neuro-monitoring and ICU care in the post-op period to give the best outcome for these aneurysm patients.